Welcome to Healthcare Shapers Perspectives, where we bring you the insights from the experts shaping healthcare today. Hosted by Diane Bryson of Inspired Health Strategies.
I am glad to be speaking today with Erkan Hassan. I'm Diane Bryson, the host of the Healthcare Shapers series of podcasts. And I'm going to hand this over to Erkan to introduce himself.
Thanks, Diane. Hello, everyone. I'm Erkan Hassan. I'm a PharmD by formal training. I spent the first 19 years of my career at university and academic medical centers at the bedside, developing ICU clinical practice and clinical experience. I then spent 20 years designing and implementing innovative technologies within integrated healthcare delivery systems focused on patient-centered clinical and financial outcomes, really to meet the quadruple aim. And most recently, I'm an independent consultant working with health systems, healthcare innovators to improve the quality of care for the patient in the bed.
Okay. I'm going to come back to you with that quadruple aim to make sure everybody knows what you're talking about. Okay. So we're here today to talk to Erkan about his experiences and the three, as this is titled, the three challenges for healthcare innovators to blend clinical needs into business success. Did you come up with that title by yourself, Erkan?
I did. I over the course of years, it's interesting to see how healthcare innovators face different challenges they may have functionally or technologically superior products, but they still face a number of challenges because the healthcare space is so unique.
Okay, so that's good. I love that this is your thing. I know this. So I'm going to start by asking Erkan a series of questions, but I know that Erkan is going to be able to share a lot of knowledge, a lot of experience with us in these questions. So for healthcare innovators, what are the must-haves for them to be successful with minimal resources? And I emphasize minimal.
It's a really tough challenge, Diane. I think their biggest challenge, the two or three biggest challenges, if I have liberty to list two or three, is the first is, I have a number of healthcare innovators who come and say, help me launch my healthcare innovative product. And to me, it's, I think you need to rethink this in terms of yes, you want a successful launch, but what you really want is a plan for a commercial success. That's just changing that mind shift, I think, is important. Second, I think as a startup, as a healthcare innovator, as you're going and dealing with health systems and large systems or large groups of practices of providers, no one is going to take a risk. No one of these early adopters are going to take a risk without clinical data. The first question you're going to get is, show me your clinical data. And so I think one of the biggest challenges and a must-have before you start approaching providers, health systems providers, et cetera, is to really have clinical evidence. And David Nash, who's the founding dean of the Thomas Jefferson School of Population Health, he retired a couple of years ago. He has this great quote that I love, I steal, but I give him credit for, is no outcome, no income.
Yep, I took that from him too.
You have to show that what you built actually does what you say it does. And I think there are traps, especially for healthcare innovators, especially with limited resources. And the two big traps is, number one, when I say you need clinical validation, people automatically start thinking, I need a 10,000 patient, 2-year randomized controlled trial that will pass FDA muster. And the answer is no, you don't. You need clinical validation to simply show that your product does what you say it does. And so honing in on that and really fine-tuning that to really get what you need is really critical. I think it's a small number of patients And my personal opinion is this can be done over, once you start data collection, once you get it all done and get the data collection period, you're really looking at about 90, 120 days of data collection before you have enough to determine whether it really meets the need or not. And I think the second big problem or pothole that healthcare innovators fall into that you have to avoid with limited resources is falling into the concern of what I call pilot purgatory. And you don't want to keep doing one after the other, after the other, after the other. You don't have the luxury to do that. You got to avoid that.
And can you avoid that just simply by taking on an agile philosophy?
You know, I think an agile philosophy helps in a number of different ways. Number one is partnering with a client in the development phase to really building what clinicians will use the way they will use them. I think that's a big mistake that's often made, and being able to turn that around in a 2-week turnaround time is an important, taking that feedback in and then turning it back around is really important. But you have to have an end goal in mind, right? And it's not going from 1 2 week to the next 2 weeks to the next 2 weeks. You really have to see the whole, what is it in your solution? And I prefer to call it a solution rather than a product, because that's what you should be offering to healthcare systems, is a solution, not a product.
That's an interesting perspective on that. Because even as I hear you, I'm thinking about developers with whom I've worked or people who have developed platforms and how they are testing it. And many times you're right, they're not getting the clinical validation. I've learned that from you. I want to go back because I promised I would come back to talk about that quadruple
AIM.
Pardon?
Quadruple AIM.
Right. Thank you. So clearly, I don't know the quadruple aim. So tell us about that.
Well, it started as the triple AIM, and then it went to the quadruple AIM.
Okay.
But really, it relates to, you need to show improved clinical outcomes. You need to show improved financial outcomes. You need to show satisfaction. And crap, there's a fourth one. We're going to have to edit this out because I forgot what it was.
All right. You want to look at it and we can ask that question again.
Yeah. Okay. Let me
It's okay. That's why we're doing an hour.
where am I?
And it'll get edited down. And you should have seen me. I just fought to keep my cat out of the picture.
Get out of here, cat.
Wanted to sit up here with me.
I think it's okay. So clinical cost.
So I'm going to come back and start over and asking that question. Okay, that was at Mark. It looked like, I think it was Mark 7.
Oh, okay. All right. Okay. Go ahead.
Okay. So now I want to come back. I promised the listeners that I would come back and ask you about the quadruple aim. Can you talk a bit about that?
Yeah, the goal of the quadruple aim is really to enhance the overall healthcare experience. And there's 4 components to it. And I think it overlaps really nicely with healthcare innovators in terms of how they build their solution. And we'll talk more about that. But really the 4 components are better clinical outcomes at a lower cost that improves the patient experience and engagement. And it also improves the provider experience and engagement. And let me go back, because when I say patient, it's really patient and family.
Okay.
So,
that's good. That's good.
All of those factors are the goal of the quadruple aim. And so I think that feeds in very nicely to the healthcare innovator product solution development, because you need to consider these as you build your metrics for success of how am I going to report and my clinical validation of, is my solution designed to address one or all of the features of the quadruple aim? Okay.
That really does make sense to me. As much as I am very patient focused, I have to be reminded that the physician's experience has to be as good as the patient's experience and family. I love that you have included that.
Yeah, the family as well. And, you know, a really good example of that are EHRs. I mean, the EHRs have been such a daunting challenge, although mandated pretty much, but it's a big cause of frustration and staff and provider dissatisfaction and burnout because it's such a difficult thing to do.
A lot of data input, a lot of data to manage. So this is going to go back a bit to the question about being agile. Is there such thing as an MVP, a minimal viable product in healthcare when patients' lives are at stake?
That's a really good question, Diane. And you know, in my opinion, yes, there is. And I think it goes back, let's even take it back a step and really ask the question, as a healthcare innovator, what problem are you trying to solve? And, you know, I think a lot of companies, small as well as very big companies, develop solutions looking for problems rather than the other way around. Mm. And so I think you have to ask, what problem am I trying to solve? And then how do I identify the problem? And I think in healthcare, there's a number of problems in terms of assimilating and managing the clinical presentation of the data. And so what is the MVP? If you have, for example, if you have a widget, a solution that's a remote monitoring device for blood pressure, mm-hmm. and you design it and you build it, the MVP would be measure blood pressure and let me know when it's above or below a range. Very simple. How efficient and how effective is that going to solve the problem? And the answer to that is, if you notify me as a clinician, you notify me that Diane's at home and her blood pressure is out of the normal range. Mm-hmm. Did you meet MVP? Yeah, you met the function of what you built. However, as a clinician, my first question is going to be, what was it before? Right. How often have I been getting it? Mm-hmm. And how does it relate? So, you know, the problem in healthcare is data is scattered through a variety of sources. And you have to go hunt and peck for all this information. One of the reasons for the frustration of not meeting quadruple aim for providers. And there may be data that's missing. So if I'm only measuring blood pressure in you once a day, is that enough? And how does it relate to patient context? If you're not telling me anything about patient context, for example, yes, Diane lives at that blood pressure all the time. That's different than, this is very new for Diane. So defining what MVP is and again, the key word is minimal, right? Because you don't need to go out and boil the ocean. You need to determine what MVP is for commercial success to achieve your quadruple aim.
Okay, that makes sense to me. And as you're talking, I'm hearing different platform developers in my head talking about data points and how many do we collect and do we limit them. So that sounds like also that comes into that kind of thinking comes into play in talking to a clinician early.
Right.
Someone like you.
You can't build it in isolation. You can't build it in isolation.
I also have been talking to someone at the FDA, at least the FDA has finally now realized that they need to bring the tech people in early instead of waiting until they think they need the technology. It's like, yes. So it's all about early, getting everybody together as early as possible to get all that input. Okay, that makes sense to me. Most healthcare innovators provide a technical solution to a health system and walk away, which is crazy. What are the challenges in addressing this process, this approach? What are the challenges that you can talk about in that?
Well, I think the major lesson there is that simply installing, turning on a technology and leaving, you don't get the results you're looking for. It doesn't happen by doing that. You can't simply drop a technology, turn it on, and then walk away.
What happens when they do that? They
Well,
just walk away. That's the usual result.
In my opinion, and in my experience, you have to show the clinicians how to integrate that into workflow, how to integrate your innovation and your solution into their workflow in terms of, and it doesn't have to be minutia detail, but it has to be a framework of this is how you can incorporate this into your workflow to make your life better. And there's several things with that.
So I'm sorry, I just want to go back because it sounds like then when they do just walk away, the solution really isn't part of their workflow, and therefore they perceive the solution as a failure. Well,
two things. If you don't incorporate it into the workflow, they're not going to do it. They're busy. They're not going to typically, 80-20 rule, typically they're not going to do that. So it's going to sit on a shelf. And after a period of time, 6 months, a year, they're going to turn around and say, why are we spending the money on this? And they're like, we don't use it. And if you don't use it, we shouldn't be spending the money on it. Get rid of it.
Right.
So if you're dependent, if you wait, I've dealt with companies that have clinically validated their solution, and I'm like, okay, now we need to show how to clinically integrate it into workflow. They're like, we're going to let each hospital figure it out for themselves because everybody's different, right? Everybody's patient is different. And it's not really, but everybody thinks it is. And so everybody's situation is unique, and the workflows are different. And we're going to let them figure it out for themselves. And I think that's a big mistake. You need to at least provide a framework of a starting point for them to get together and all the key constituents figure out, okay, does the framework that you provided make sense? Do we need to elaborate it further, or do we need to change it? And it's not about the technology. What you're really trying to do is change the culture and the people and the process of how you're taking care of patients.
That sounds like a real big culture shift.
It is. It's a big culture shift. It's a process change. It's not about the technology. The technology takes up this much of it. And the outcomes, and even if you do it at one site and you go to another site and say, here you go, those do not automatically transfer over from one program or one site to another. They need to revisit it and say, because in my experience, even when you take the exact same thing from from the exact disease state, it's like, well, we do a little bit differently here, so we need to tweak this part of it here to make it fit our workflow. And the comment I wanted to make is, if you do not improve their work, you shouldn't have a product if you can't improve it. Because the three big questions you're going to get when you show up is, show me the data, clinically validated, who's using it, and how much is it going to disrupt what I currently do. So you want that minimal disruption of workflow, but you want it to improve their workload.
So it sounds like the solution developer, solution provider needs to really be prepared with a longer term work plan, and be prepared to take several sites through this process over and over and over again.
Yeah, I agree with that statement. I think they should. And I think the question as a healthcare innovator you need to ask yourself is, do you want a one-time sale, or do you want a partner for life?
That's a good point. So this is a partnership. That's true, especially if you're looking at a culture change, that technology is going to help to support that cultural shift. Okay, that's interesting. Good. Okay. Now I have another question for you. How does a healthcare innovator get their early adopters to become raving fans? We love those early adopters because they love us.
We love early adopters.
They love us right away, but I agree, they need to be fans, and they can help us move to those later adopters.
So you want your early adopters to be raving fans because they're going to do several things for you. When you get the question of, show me your clinical data, you've got it. who's using it, you have a list. And now you have a reference partner, a reference site to refer other sites to, right? And if you have these reference sites that are good, that's good for you. If you have the reference sites that are not good, not so much. Mm-hmm. And so it really goes back to helping the health system be more efficient and more effective at what they do. So that's what your solution should do. Help them be more efficient and more effective at what they do. Nobody is paid to be more efficient doing the wrong thing. So right. You want to be more efficient and more effective. And I think a big part of this really relates to metrics and your reporting. And I think one of the big mistakes that healthcare innovators make is as they build their solution and mature it and are ready to go to a health system, then they start thinking about, okay, what's my reporting and my metrics that I'm going to report out on this? And my bias is when you think of it at the tail end, that's a mistake. And you really need to think of it on day one of what am I going to report on and how am I going to use my metrics? Because when you think of it here, obviously your metrics and your reporting, you want to automate into your system as much as possible, because any manual effort to report this out is probably not going to get done. People are busy. They're running around. They don't have time for manual data collection, and that's a big negative. So the more you can automate to collect the data, the better. But when you build it, when you start thinking about metrics and reporting over here, you may have not built the automated data collection piece over here. And so now you either exclude it and it's manual, or you have to go back and re-engineer it. So from day one, you need to start thinking about what does my end product report? And you need to, in my opinion, provide a report, not just a solution, but the assessment metric report to the client. And it needs to consist of, very similar to the quadruple aim. I think of what are your clinical results? What are the clinical metrics you're going to produce? What are the financial metrics you're going to produce? What are the operational metrics? You're going from an operational standpoint. What are the metrics I'm going to assess? And then what are the satisfaction metrics from a provider and a patient family standpoint that I'm going to include? You need to ask those questions for all, and there may be similar things that fall into multiple buckets. You only have to collect it once, obviously, but you need to factor those in there. And so you're going to do this for several reasons. Number one, you want to report up to the administration how your solution is working in terms of your metrics, but you also want to report to the frontline workers as to this is the results that you're getting by using this system. Mm-hmm. You want to regularly assess, if I get an initial result with my solution, new solutions typically get new results. But you know what happens over time when you take your foot off the accelerator. So part of the reporting is, am I continuing to achieve the results that I initially got? And if so, what's working? If not, what's not working? And out of all my metrics, I can then identify future areas that I either need to enhance my solution with or to focus on in terms of culture process changes. And then finally, I think in terms of benchmarking, how am I as a 300-bed community hospital doing in these metrics relative to other 300-bed community hospitals in my geographic region and outside my geographic region? And how are all my providers, my doctors and nurses, and whoever else is using the system? Is there an outlier that's not using it properly and is contributing a problem area that we need further education on? Or is who's aligned, who's really doing it well? And what can we learn from them that's doing it well so that others do it just as well?
Thank you for watching Healthcare Shapers Perspectives, where we bring you the insights from the experts shaping healthcare today. For more episodes, visit healthcareshapers.com/perspectives.